America, listen to me right now. If you care about your paycheck, your family, your future, you need to hear this. Subsidies don't fix healthcare, they just hide the bills and stick you at the cost later. If you want real solutions and not fake promises, hit follow, subscribe, and share this episode because what you're about to hear is the truth no one in Washington wants you to hear or has the guts to tell you. Well, let's talk about the subsidy illusion, right? Without subsidies, the ACA premiums in 2026 are projected to go up 114%. If nearly half of Americans can't afford it that use this, is it really affordable? How can you call it the Affordable Care Act? With subsidies, net premiums appear to drop 44%. So, regardless, these people that can't afford it are paying more. Enhanced ACA credits, in 2024 cut the average family's payment to about $888. Without them, it had been almost $1,600, a 75% hike. Yet 38% of adults, or I'm sorry, 38% of insured adults under 65 worry about paying monthly premiums, and nearly 50% worry about deductibles. I know most people with healthcare, even good insurance, worry about deductibles. It's insane. Our healthcare system is the least capitalistic system we probably have in this country. And we're going to talk a little bit more about that. Subsidies don't solve the cost, they just shift it back to you through payroll taxes and deficits. Would you call a car affordable if you can't afford the gas to drive it? Why are we calling this affordable care? It's not affordable care if you have to go through these processes to make it happen. You can't say it's affordable care if you have to decide between that and paying your electric bill to be able to get what you need done. They like to go, oh, we've solved that problem. No, all they've done is shift it from your coming out of your check to raising taxes in order to be able to afford it, right? Because that's going to happen at some point. They got to get the money from somewhere. It's not a free ride. I'm not opposing taking care of people that can't afford it, but there's better ways to do this. Let's talk a little bit about the cost. Cost is the disease in healthcare. Cost is the disease. Total spent 4.9 trillion in 2023. That's an average of $14,570 per person, which is 17.6% of American GDP. Let's break down who pays for it, right? Private healthcare, 1.5 trillion. Medicare, 1 trillion. Medicaid, 880 billion. Out of pocket, 490 billion, or 10% of the cost. Think about that. Only 10% of the cost that you're paying, those crazy prices you're paying, that crazy amount that you can barely afford, only 10% of it is what you pay out of pocket. That's wild. How does it cost so much money? Administration is a huge part of it. When you talk about hospitals, right? 33% of all spending. Same MRI, one state, $400, and another, it's $4,000. That's just crazy. But that's why I say healthcare needs to be done at a state level because of the different infrastructures and the setups of all the state governments. It doesn't make sense to do it on a national level when the structures change everywhere depending on the state, right? If there's a certain state that struggles to it, maybe there should be some sort to kind of help them get to a point where they can be self-sustaining, but that's where we need to be, you know, to a degree like that. It needs to be done at the state level because state governments, even Republicans, they are far more willing to come to a compromise and things like that than we are in the national government or federal government. I'm sorry. And it doesn't make sense. It just doesn't make sense. And especially when you break down the cost, right? California versus like my home state, Michigan, very vastly different cost structures. So how can you really create a sustainable and a system that works for the average person at the federal level when you have such vast differences? Let's talk a little bit about waste, right? At least 30% of all health spending in the United States is waste. That's 1.4 trillion out of all that money per year that's considered wasteful. Yeah, I'm sure that you can get plus or minus depending, right? Let's even get down to another one. Administrative cost in the United States. 8% of US healthcare spending goes to administration compared to, let's say, Europe, 2 to 4%. I get that it's quote unquote nationalized systems in a lot of countries there, but the Norwegians don't have a nationalized system. It's very similar to ours, a little bit more different aspects of it, but they do it correct. I would say correctly, but they do it in a better way that works for the average person there. But we're drowning in paperwork and markups. Americans are paying luxury prices for a bureaucracy while outcomes lag behind our peers, right? And when you look at our system, the amount of hospitals, doctors, not doctors, but beds in hospital systems, cancer centers, all these are the amount of them are regulated by the government. So when you talk about, ooh, da, 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 well, no, the government limits the players. So yeah, there is an oligarchy, especially when it comes to healthcare, right? There's no competitive, it's just not, it's not competitive. It may be competitive for the nurses and doctors looking for jobs, but it's definitely not competitive for the person who receiving the service. It's just not, like the cost structure shows it. Why do we spend more on clerks and coding than Europe spends on doctors? If your mechanic charged you triple to fill out a form, would you keep going back? I wouldn't. When the bill is this big, do subsidies do anything except hide the bleeding? Like I said, all it does is shift it from what you see on your what you're going, oh, I'm paying this much for healthcare, to the government coming to you at some point, hey, we got to raise taxes, the deficit's going up, we got to increase usage taxes, or we got to cut back on this. It's gonna happen. The money comes from somewhere. Every country set up like that, even a communist country, the money has to come from somewhere. Don't let either side fool you, because they're both lying to you. Democrats and Republicans are lying to you. Subsidies are not a fix. Demand that they go after waste, markups, broken pricing, and administration. You tackle those four, you can control healthcare costs for employers and Americans, and you can even work on implementing a hybrid system or like some kind of concept, right? I'm going to talk about a concept that they've used in several nations. I'm not saying we have to do this. I'm just saying it's a starting point. The single payer mirage that might work in Canada and other countries, right? But it's certain, just because it works there doesn't even necessarily mean it works here, right? Like the hybrid model may not work here, but it's a starting point to talk about. A national single payer plan in the United States will require trillions in new federal spending. And don't buy into the hype that it'll save money, right? Because I'm not saying that there's this thing, but how they do is they project how much money it can save. They have zero actual idea how much money it could save. It's all based on what they project it to save. Pay attention to that. Done projected. They have zero actual idea. And that's how they're able to turn around and sell these bonds and things like that to pay for debt. But that's a whole nother debate. We'll address that one. One estimate is over 10 years we'd pay $32 trillion. That's from the American Action Forum, CBO. Provider cuts. These savings assume, like I was saying, that hospital and doctor payments would be cut by 30 to 40%. That means that you would see a 30-40% payment to doctors and hospitals. And what that means is there's going to be less money available for doctors, less money available for nurses, or people are going to have to accept lower wages, lower benefits, something of that nature. And that is a problem. Well, that risks closures, especially in rural areas. Let's look at Vermont, right? In 2014, they abandoned single payer after state economists showed massive financing gaps that would have required doubling state taxes in order to maintain it. The voter isn't going to be okay with that. The access myth: coverage doesn't equal access, and reimbursements are cut, providers reduce capacity, wait times, and closures will follow. That's how our system is set up here, or our mirage, if you want to call it. Medicare for all sounds clean, but in reality, it's messy and it doesn't work at the federal level. A card in your wall is worthless if there's no doctor available in your country to use it. Do you want DC running every hospital the way they run the DMV or the way they run Veterans Affairs? No, if we want things like that, it should definitely be done at the state level. States are more equipped to handle the needs of the citizens of their state than the federal government is. Would you rather a piece of paper that says you're covered or an actual hospital that stays open? Remember, whatever we do has to be able to maintain and improve our healthcare system. If Vermont, one of the most responsible states in our country, couldn't make a single payer system work for 600,000 people, how are we going to make it work for 330 million people in the United States? Let's do a quick fact pack information, right? Health spending, 4.9 trillion in 2023. Like we were saying, $14,570 per person, even if it was subsidized. That's 17.6% of the GDP of the United States. Affordability, 38% of insured adults under the age of 65 worry about premiums. 50% are worrying about deductibles. I have private health insurance. My deductible is almost like $3,000, $4,000, something like that. I know people who have it up to $7,000. Subsidies, $888 a month net subsidies, almost 1,600 without it. This is like a year or two ago. Insurers are already pricing 2026, assuming subsidy cuts, adding 4%. So they're adding 4% on top of what they're already going to charge without the subsidies. So you're telling me the government giving you free money makes you not have to charge less? Shouldn't it just be the same? Just depends who gives you the subsidy or not? Tell me that's not backwards. Maryland, they have an all payer budget save plan, 1.4 billion in Medicare spending over 5 years. California capped healthcare cost growth at 3.5 to 3.2 to 3.0%. Employers often pay 2 to 300% of the Medicare rates for identical services. Imagine if private healthcare was paying at least half of what they were. Your premiums might not go up and might even fall. You know, like I said, Vermont abandoned a single payer system that they were testing out. If this were milk or gas, there'd be riots. People would not tolerate paying this much. Instead, it's hidden under jargon like adjusted rates, which is horse manure. Let's talk about a couple small questions, right? Why is $400 care in one zip code worth $4,000 in another? Whether you're rich or poor, that's the value. Would you pay $80 for milk if your neighbor paid $8? Probably not. Why are we okay with this insanity in the cost in healthcare? It makes absolutely zero sense. Makes no sense at all why we continue to tolerate it. The state level hybrid pen, let's kind of talk about like that. That's merging some things they've done in other countries, even parts of the United States. Global budgets, Maryland, all payers pay the same negotiated rate. Stops hospitals from chasing volume. They saved 1.4. Obviously we talked about cost growth target in California, but I feel like that's kind of skewed because of how the rest of California's economy set up and things can kind of go boop, 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 boop. It's just a little bit different than the rest of the nation, which is again why I advocate we do some of these things at the state level to protect the individual at the state level. Let's talk about a market architecture. Tie commercial prices to Medicare, maybe plus 15%, however you want to do it. Transparency. President Trump was working on his first term, kind of fell flat the last 4 years, and then now they're bringing it up again. Publish prices. Fine non-compliance. If you don't do it, you should be fined $10 million per instance. Real quick, everybody would be publishing them prices. At $10 million a clip, they'd have zero issue publishing them. Drug purchasing consortiums, right? Pool Medicaid, state workers, and private employers. You could save 5 to 10% easily on the price of drugs that way. You could probably save more depending on the situation. Let's lean on the public option for a little bit, right? Run by a private TPA, but not government bureaucracy, right? But it would still be kind of controlled, maybe to control the costs. Let's get the rates pegged to Medicare plus the margin, like we were talking before. Auto default for state employees and state senators and your state house reps, all state government workers, everybody that works for the state would be defaulted under that system. They would not get anything special than the average citizen. We could talk value based care as well, right? Bundled payments for high cost episodes, working through the state, or not working through the state, I'm sorry, working through your insurer. Shared savings for chronic diseases. We need to have a better support system for that. Penalties for avoidable readmissions, right? So if they try to push you out because they didn't do what they were supposed to do, they're going to get penalized for it. They need to make sure that you are not going to have to come back in a day because they screwed something up and wanted to squeeze someone else in. Well, let's talk about consumer affordability. Imagine scaled cost sharing reductions built into your rates based on your income. Out-of-pocket caps enforced if cost targets are not met. So if they can't figure out, even though they're jacking up the price, markups, they can't figure out how to cap it, guess what? They're going to be penalized. Why not make insurers compete like airlines, food companies do on price and service? They don't. It's all protected. It's protected. The game players are limited. When game players are limited, it drives up price. That's a proven fact. Why do we trust DC when your state can put guardrails in place today and they're actually going to enforce them? State government does more for the average person than the federal government. Let's remember that. Isn't it time patients had a referee in the game? Because right now it's just the oligarchs or the top people, however you want to word it, pharmaceuticals, hospital companies that are doing all of it. You know, and this is why we talk at the middle ground about competition, accountability, and affordability, because that's what matters more to Americans than this rhetoric that's being put out in DC that they get all the people that are already hyper focused and hyper mad about a lot of things. That's you're hearing the squeak wheel gets the grease. The average American cares about the actual price, actually about what they're going to pay. The actual average American, the middle person, the independent, is tired of hearing about it every day. What are you going to do to fix the cost? I don't care about the subsidies. What are you going to do to fix the cost so then we have to keep needing subsidies? Fix that, you're going to fix a lot more problems and the government can get out of the way. Let's talk about the potential savings if we went to a little bit more of a model like this, right? You know, our budget across the board, depending on each state, could be 1.4 billion to 3 billion right off the top. Growth caps, billions could be avoided on top of that every year. Reference pricing, you can save up to $3.3 billion a year alone. Drug reforms, you can save up, and this is on the state average, over $2.2 billion per year. Admin simplification, $1.46 billion a year. And we talked about waste. We talked about prescriptions, things like that, right? We talked, you could be up to 20 to 30, even 40%, depending on the situation. Each 1% saved on healthcare average spending would be $1.46 billion saved per year. You could literally easily shave off $100 billion that we're spending on healthcare almost at a state level, depending on your state, right? Probably less than, the Midwest, right? Because of our cost structure. What could your state do with billions extra every year? Should that money go to bureaucracy or should it go to schools, bridges, families, taking care of problems that we need to take care of without raising your taxes? Think about billions going back into schools, bridges, infrastructure, all those things you need that we need to get fixed in our states without having to add extra taxes. Makes a whole lot of sense, right? Because we need problems to be fixed because a lot of our infrastructure is crumbling. Things look like crap. Who benefits from the crosswind wild? It sure isn't the average American, only the system. If you're insured and still scared of the bill, you're not alone. 4 in 10 feel the same. Like I've said, subsidies don't cure the disease. They're just hiding until premiums jump and they raise your taxes on top of it. States can lead. Maryland proved it. California capped it. Like I said, there's a lot of gray area in there. But they took action. They had the courage to do it. Does your state have the guts to do something for you? Ask your state senator, ask your state representative, do they have the guts to do something that helps you, the average taxpayer? And ask it to them just like that. Do they have the guts to actually do something for you? Competition needs a referee, but there's also got to actually be competition and not a rigged system. And we need a scoreboard. So here's the bottom line. Subsidies are a trick and a lie to get both sides to fight against each other because the healthcare companies and drug companies line their pockets while you're busy fighting. Single payer, in most places in the United States, it would be a mirage just because of how we're structured as a country. It may work in England, may work in Canada, but how we do business in America, it doesn't work. And the system would collapse. Our government can't even figure out how to pay for Social Security, which we pay into that they're not supposed to touch. And you're going to trust them with that? Disease is the cost in the United States. I'm sorry, the cost is the disease. That's the problem. Until we demand real structural reform, global, national budgets, growth caps, transparency, public options, American families are going to keep drowning. Share this episode, send it to your state reps. Don't tell them, don't sell me access I can't afford. Because access doesn't start with your card in the wallet. It starts with you being able to pay the bill that you're given, period. Have a good day.